And good morning, everyone. Let's give it another couple minutes so everybody can jump on the call. We'll start at about 9:31, and really excited about what Anthem has to bring to the table. So I'll go back on mute and we'll get this thing started. Thanks. Good morning, everyone, and welcome to the webinar. October 5th, 2023. Today, we're joined by our friend and colleague, Kathy Shiplett of Anthem. She'll be going over the 2023 open enrollment for Anthem for the individual market. Here's some housekeeping. You guys know the drill. If you have a question, put it in the question box. We'll get to those at the end of the presentation. Okay. Today's presentation, under 45 minutes, so we're gonna, get you back to your daily duties and get you on your way, but we'll keep things fast and moving along here. On the call with me today is Eric Pouncey Jr. He's also a broker specialist like me. And there's our contact information. You can also follow us on social media. Check out the Monday Minute. That's a great place to learn the latest, not only on the individual market, but group as well, and other industry updates. As Cornerstone Broker, you have access to expert services from our agency services program that can help you with business outside your scope and planning for the future. We'll create a customized plan based on your specific needs to ensure that you and your business and your family are covered. Contact us today. From downloadable social media images to customizable flyers, Cornerstone's Marketing Hub has what you need to start managing your marketing in-house. You can access the Marketing Hub through the Cornerstone Resource Center with your username and password. Please contact Jess Larkin, jlarkin@crnstone.com with any questions. Folks who are familiar with our website, we have a resource center, and we did put a little lock on it. You'll have to enter your username and password. It's really easy. You probably already have one. You might just need to go out there and reset it. But if you do run into issues, just email jlarkin@crnstone.com. And let's toss it to Kathy, and let me make her the presenter. Good morning, Kathy.
Good morning, Geoff. Can you hear me okay?
I can hear you okay.
All right, let's start presenting. Let me know if you can see my screen.
We can see your screen. Fantastic.
Okay, perfect. All right. Well, let me get started here. We've got a lot to cover. So let me get it right into it. What we are going to be sharing today, why Anthem, what makes us different. We'll talk about open enrollment, medical product overview for 2023. We'll also touch on our Anthem Enhanced Choice product and our specialty individual standalone dental and vision. You can count on us to deliver our promise to reimagine health, because unlike any other health company, everything we do ladders up to these three bold building blocks that guide our vision. All of our products, services, and innovations, everything we do, they establish the foundation for everything that is possible. Through our investment in people, tools, and innovation, we increase and improve health outcomes, connecting individuals to care with empathy, offering simpler, more effective, and more affordable results. Together with our trusted partners, we bring innovation through the local depth and expertise of the Blues to solve the toughest challenges. Our entire digital platform is the first of its kind in the industry. It's a fully integrated ecosystem that connects every point of interaction to every stakeholder to elevate the human experience. The number one takeaway here is that we keep the member at the center of the equation, and this takes precedence over everything else. That's how our single digital first platform connects the entire world of health. Digital and data fuel every aspect of how members experience care through Sydney Health and Anthem.com, how providers share insights for better care delivery, and how you and your clients manage plans and membership, and how the entire healthcare community works better when it works together. All of our discussions around digital and AI can sound very complex, and where Anthem simplifies all of this is through our member app, Sydney Health. It's the front door to everything a member needs for their healthcare journey. Members love the Sydney Health app. It has a rating of 4.7 stars on the Apple App Store, and Sydney has received multiple industry awards. The reason that we put all of these awards up here for you to see is not just to brag, but to make you feel even more confident that your clients have an elevated experience when they use Sydney. It's worth taking an extra second here to talk about how Sydney Health helps members improve their health. Sydney serves up easy ways that they can act right now. Did you know that there are 350,000 health-related apps on the App Store? Our experts comb through all of these and they pilot the best ones. And only when we see real results do we integrate them into our digital solutions. AI-powered messages encourage proactive health actions to help members make smarter choices. We can leverage 139 unique medical conditions to better identify members who are clinically and or financially at risk so that they get personalized care guidance. Sydney easily syncs with fitness trackers, glucose monitors, and other devices so that members can connect all of the ways that they stay healthy. This is a snapshot of the My Health and Wellness dashboard, which is one of the features on Sydney. Members can use it to create personalized clinical action plans to help them reach their goals. Just some of the action plans available include reducing stress, increasing energy, sleeping well, eating healthy, losing weight, and quit smoking. It's important to know that members are embracing these features too. We've seen a 131% increase in the app utilization of our health and wellness tools. So next, let's take a look at the broker tools. There are three main broker tools: the producer toolbox, which I believe you would all be familiar with. This is where you can go for commissions, forms, quoting, everything to do. Anthem.com is your producer toolbox. The Broker Plus app is the mobile version of Producer Toolbox. And finally, the Broker Hub. And this is where you will find all of your promotional and marketing materials for Anthem. With the Broker Plus app, it is the easiest way to stay up to date on the broker news. You can check your commissions right on your phone. You can also check the status of applications while you're waiting to see a client. A brand new feature that we have added to the Broker Plus app is the guest access. And this would allow you to view the news on the Broker Hub without having to log in for the full access. We have received a lot of awards on our Broker Plus app as well. And if you don't have this downloaded on your phone, you can scan the QR code on your screen and it will take you directly to either Google Play or the App Store so that you can download it. We launched our Anthem Broker Hub as a way to house all of the information that you would need to sell in one location. And we've gotten some great feedback from brokers. A couple of quotes that we have received. One is, if I had Broker Hub 3 years ago, I would still have hair. We are very sad to know that we're responsible for hair loss. And also the Broker Hub leapfrogs the competition. And this site was built specifically for you to help solve the problem of where to go for what. So if you haven't seen it yet, please check it out. I highly recommend to bookmark this. It's anthembrokerhub.com. From here, you have all of the selling materials for all of the products in one place. This is for individuals, small group, large group, all products, and all states. So it's easily searchable. You can put in which state, which segment you're looking for in the specific product, information that you need, all of the marketing materials that you would need to sell Anthem products. And another feature on this site that helps make your life easier is the ability to share any of the materials instantly with your client directly from the site. So let's look at open enrollment for 2023. As everybody knows, open enrollment is beginning November 1st and it runs through January 15th. Currently, we have 45 million Americans that are covered by Anthem. And as we've discussed, the Sydney Mobile Health app supports them wherever they go. And this includes finding care. We have a find care tool that members can be confident that wherever they go and whatever they need, they will have access to the great benefits that go along with their Anthem coverage. And keep in mind when we're going into open enrollment that 9 out of 10 individual members are eligible to receive financial help. So it is easier than ever for our members to connect confidently with affordable health care. The marketing materials are now available for you for 10/1 shopping. They are out on the anthembrokerhub.com right now. Some of the pieces that are available, these are all available as one kit in a digimag, but we have the product guides, benefit booklets, specialty product brochures, and HSA flyers that are all available right now for 10/1 shopping. So 2023 ACA renewals. The renewals will be mailed to the members around October 20th. There will be a broker reminder article that will go out the day before. Beginning in late October, you will be able to go into the producer toolbox, select book of business, and then choose renewals. And you will be able to see the renewal letter links for all of your ACA clients. A couple of things with the catastrophic plans. If you have members that are on exchange and it's either the spouse or the subscriber, and they are either already 30 or will be turning 30 by December 31st, they will be transitioned to a bronze plan. So their renewal packet is going to be moving them to a bronze plan. We will also send off-exchange subscribers turning 30 by December 31st, a transition to a bronze plan packet. However, if you have a member that is off-exchange and the spouse is turning 30, the spouse will receive a cancellation notice, but the subscriber, along with the other eligible plan members, will renew on the existing plan. So that's one difference between being on exchange and off exchange. for the spouse on a catastrophic plan. You have members that are enrolled in our dental and vision. If it is standalone, they will receive the renewal details in a renewal packet. If they have dental and vision along with their medical, all of those products will be included in their one renewal packet. Members renew in 2023 plans and will receive a summary of the benefit changes in their renewal packet. Changes can be made via EDE, which we will be talking about now. This is available for on-exchange ACA plans in FFM states such as Ohio. Enhanced direct enrollment technology makes it easier for the consumer and the broker to shop, quote, and enroll in health coverage with Anthem. Consumers and brokers can complete all steps of the eligibility and enrollment process in a single website. So with EDE, you will be able to visit the producer toolbox to shop and quote to help your clients enroll in an Anthem plan or FFM. You can manage existing Anthem ACA clients, including updating demographic data, adding, removing dependents, and more using myanthemchoices.com. You can use enroll.anthem.com to shop only on exchange plans. In the cover letter, the on-exchange members will be directed to go to myanthemchoices.com to view their 2022 rate plan and to update any personal information. And by using this EDE functionality, members can see right there whether they qualify for financial help. They can check out their other options and enroll in a different plan, and they don't need to go into healthcare.gov to do any of these. Now with our grandmothered and grandfathered renewals for January, the grandmothered renewals will be mailed out to the members on October 25th on or around, and grandfathered letters will mail out on or around November 1st. This is the 60 days prior to the renewal date. And as a reminder, when you're looking for the renewals online for grandmothered and grandfathered, there is a renewal file that is uploaded to the producer toolbox. You can see the information on all of your renewals there, but you will not be able to view an actual renewal letter for grandmothered or grandfathered business like you do for ACA. For grandmothered, grandfathered, it is the renewal file. Next, let's jump into the medical products and take a look at what we have in 2023. Our individual plans are among the most sought after plans because of our broad choices and wide range of benefits that we offer. Let's lead in with our top three headlines. Some individuals qualify for $0 premiums. And keep in mind that our individual plans include smart reward incentives of up to $45. We'll talk about that more in a moment. We also offer $0 copays for preventive and virtual care. And for many common use drugs, individuals have a $0 copay. Starting with our ACA medical plans, let's take a look at what we have to offer. We have 15 different non-standard portfolio design plans. These are the plans that we have been offering. This year, we are actually rolling out some standard plans that are set up that have been added to our portfolio. But for the non-standard plans, we're offering 6 bronze, 6 silver, 2 silver off exchange, and only 1 catastrophic plan. The network we use is Pathway HMO. It is also referred to Pathway X if it is on exchange, but this is the same HMO network. Pathway or Pathway X is the same network. Some of the features on our ACA individual plans, we utilize the RX Choice tiered network. This is the pharmacy network. We utilize the Select formulary. We also offer optional home delivery, and our individual foundation plus engagement wellness package. New for this year, we have our standard portfolio designs. In this package, in this portfolio, we offer 2 bronze, 1 silver, and 1 gold. This product will use our base RX network, which is our national RX network, not the RX choice tiered. We continue to use the select formulary, optional home delivery, and the individual foundational plus engagement wellbeing package. We're offering a couple of new plans this year, both of them silver. One is the Silver Pathway HMO 6100 with HSA, and the next one is the Silver Pathway HMO 4250. And you'll notice the plan design has some more descriptors at the end of it. It will say plus incentives, $0 virtual PCP, plus $0 select drugs. So we are getting more descriptive in our plan names for 2023. There are 4 plans that we will be discontinuing, and the slide in front of you is showing what anyone who is currently on one of these plans, what they would be mapped to. And I'm not going to go through each one in detail. We will be sharing this presentation so that you will have this as a reference where you can look at this more in your leisure. So as I mentioned, with all of our plans, we're adding some additional information in the plan name. In this example, Silver Pathway HMO 4000, we've added in that it is a $0 virtual PCP plus $0 select drugs and incentives. We are also reducing the cost share for Live Health Online to a $0 copay. Now, this will only apply to copay plans, so these will be the PPO plans. It does not apply to an HSA or a catastrophic. But anyone that is on a copay type plan, Live Health Online visits are now at no cost share. We continue to offer live chat with an agent available through our Sydney app. This is included with their plans. The live chat is available 24/7 and 365 days a year. We also continue to offer our member wellness incentives. When you see in the name it says plus incentives, this is what it is referring to. Members can receive up to $45 in a digital gift card for completing a couple of different wellness pieces. And most of our plans they utilize the RX Choice Tier 2 pharmacy network. There is going to be an increase in the level 2 cost shares. Currently, it is a $10 or 10% differential between the pharmacies in Tier 1 and Tier 2. Going into 2023, that differential is going to be $15 or 15%. So members still have the option of using whatever pharmacy they choose, but they may be paying more out of pocket if they're using a pharmacy that is in Tier 2 versus Tier 1. We also offer some select Tier 1 prescriptions at a $0 copay. That is something we rolled out in 2022, and we are continuing that into 2023. The next couple of slides give you in detail what is changing within the existing plans. And I'm not going to outline these and talk through each detail. As I mentioned, you will have this presentation for review at a later date, and you will have these as reference. But you can see that we are adjusting out-of-pockets, deductibles. Some are going up, some are going down. We're just making the tweaks that we need to in order to remain competitive and also to make sure we're staying within the correct actuarial values. And again, this outlines some of the changes that are happening within some of our specific plans. On the previous slide, it was mostly out-of-pocket and co-insurance, deductibles. Here we have some more details that are changing within the plan design, such as the office visit copay, urgent care, and some changes in the RX coverage. Anthem also offers an integrated health savings account. When your members are choosing an HSA, they can also have their banking account set up for their HSA account with Anthem. And when they choose to do the Anthem HSA, everything is in one place for them. So they do receive a debit card so that they can pay for the out-of-pocket healthcare costs. It's one website for all of their benefit and spending account information. It is all housed on the Sydney Health app so that they can go in and check their HSA balance, look for doctors or other professionals, review claims and find out if they owe anything, and pay the balance directly from their HSA on either anthem.com or the Sydney app. They can review their benefit details, deductible, out of pocket, estimate costs before you go in to see a doctor. All of your account and claims information is in one place. You can even take a photo of a receipt and upload it on your Sydney app for reimbursement from your HSA account. The customer service team is one team, one phone number for all of the customer service needs, including the savings account. In order to open an account, you can indicate this on the application with a new enrollment, or for existing members, they can contact customer service to be set up. This is the product summary. I can't read it on this slide. It's way too small, but it is in the presentation. Our benefit, all of the plan guides are also available currently on Anthem Broker Hub, so you can get the full benefit guide. But this is just one screenshot of all of the different plans that we are offering for 2023. Next, let's talk about network updates. And this is the piece that I am most excited about, top two for 2023. Currently, for 2022, we're in 82 counties, and I'm happy to say that we are able to expand into all 88 counties for 2023. This includes Claremont, Ashtabula, Geauga, Ashland, Medina, and Portage. So we will be able to cover everyone in the state of Ohio for 2023. And we are adding new providers. Top of the list in the Columbus market, we are adding Ohio Health. And I know that this is a big win for us. We're very excited that they are part of our network and expect big things from Columbus. So Ohio Health is now in the network in the Columbus market. We have also added ProMedica and University of Toledo Medical Center, Pomerane Hospital, and King's Daughters, which is just over the border into Kentucky. This is just a highlight slide. This is by no means an all-inclusive provider list, but just the highlights for some of our key areas. In Dayton, our network is created around Kettering Health Network and Premier Health. In Columbus, it is Mount Carmel and Ohio Health. Cleveland, we have Metro Health Medical Center, St. Vincent's, and Lake Health. Akron is Summa Health System. And in Akron and Worcester, we now offer Pomerane. In Toledo, we have Mercy Health System, Fulton County, Wood County, St. Luke's, ProMedica, and University of Toledo. In the Cincinnati market, we have the Christ Hospital, UC Health, and TriHealth. In Youngstown, we have Mercy and Steward Health System. And again, out of state, we have added in King's Daughters. Next, I want to talk a little bit, do a deeper dive into our well-being solutions. Our foundational programs are at the base. We start with a solid foundation, and this is included with all of our individual products. Members receive the foundational products that give them the support and tools they need to achieve their individual health goals. This would include things such as 24/7 nurse line, which we have had for many, many years. It predates all of the online applications that we have available now, but we continue to offer 24/7 nurse line. We also have behavioral health case management for other conditions, transplant, utilization management, health assessments, of course, the Sydney app. All of these are considered our foundational products. Members can also earn rewards for healthy habits through our SMART rewards. And at the end of the day, there are some fundamental truths about staying healthy. And one is staying on top of your wellness exams. And that's why we give members a $25 digital gift card just for having their wellness exam. The member would need to visit their doctor in person for an annual wellness or a well woman exam within the first 90 days of when their plan begins or when it renews. In addition, if a member completes a health assessment, they'll get another $20. So this is something that we started, the engagement package, we started in 2022, and it's continuing into 2023. And it is a way for the members to earn rewards by participating in these wellness activities. The member and the covered spouse or domestic partner is eligible to receive up to $45 per planned year. The rewards are in the form of a digital gift card, and this is all managed on the Sydney app. They can log in to redeem the rewards that they have earned, to select which gift card that they would like to have. They do have the option of receiving a physical gift card instead of the electronic gift card, but please know that there would be a processing fee deducted from the reward amount if they choose to get a physical gift card. Member is encouraged to use the rewards for products and services that promote good health. And if the member has any questions about whether the receipt of the rewards result in a taxable income to them, we recommend that they consult their tax advisor. Prescription updates for 2023. Our RX Choice tiered network for the pharmacies, we are making some changes in that network in regards to which pharmacies are in tier 1 versus tier 2. In 2022, we had roughly 26,000 pharmacies that were included in tier 2. And as a reminder, in tier 2, a member would be paying a higher cost in order to use a pharmacy that is in tier 2. It would be, for 2023, it will either be $15 or a 15% increase in the cost of the drug. For 2023, our tier 2 pharmacies, we're increasing the number of pharmacies in tier 2. It will be roughly 40,000. So there are some pharmacies that are moving from tier 1 down to tier 2. The two main names that are moving, Costco and Sam's Club, are going to be moving to tier 2. And so you know, for your existing clients, if there is anyone who has utilized one of these pharmacies, they will be getting a notice mailed directly to them of the tiering changes. They still have the choice to use any pharmacy that's in their network. But by utilizing a tier 1 pharmacy, they would pay lower out-of-pocket costs. I just realized I missed a word there. There are approximately 67,000 pharmacies that are included in our tiered network. And Tier 1 includes CVS, Walmart, and Kroger. Members also still have home delivery options, RX maintenance 90 and retail 90. And there is savings that is delivered from using the level 1 versus level 2 pharmacy network. We also utilize the select formulary for our plans. This is the ACA compliant option that helps our members control costs without compromising quality and safety. This drug list is used for exchanges and it has been developed to comply with the CMS benchmark counts. This is a closed formulary that is focused on lower cost of care options. It includes drugs in every class and category, ensuring that there are no gaps in care. And it includes lower cost generic options where more expensive brand named medications may not be part of the formulary. And if a member's doctor determines that another option is not appropriate for treatment, the doctor can request an exception review for their members. Opt-out home delivery will continue for 2023. This is for medications that are taken regularly, the maintenance meds. Members can choose to use home delivery, and they can also choose to opt out of home delivery. It is their choice. So they can continue to remain at a retail pharmacy. There is no penalty for continuing with the member's retail pharmacy if they opt out of the home delivery. Members also have the ability to choose to get a 90-day supply at CVS pharmacies for many of their maintenance meds. And this would be at the same cost as home delivery. Members are advised of the home delivery requirement at the pharmacy and would be followed by a letter from their retail when their retail courtesy fills run out. They have 3 courtesy refills at a retail pharmacy. But again, they have the option of opting out. That is just something that they would actively have to do. By using the home delivery, it offers savings and lower out-of-pocket cost for members compared to filling the prescriptions at retail. And it's also convenient to get them mailed to their home with a 90-day supply, which adds to medication adherence. Next up, I want to just kind of give a review of our Anthem Enhanced Choice product. This is a medically underwritten health plan that provides coverage for up to 12 months. It's actually 364 days, and members only need to apply once. And unlike traditional health plans, they can apply year-round, not just during an open enrollment. So anyone can apply, and with our plans, pre-existing conditions are covered right from the start for the enrolled members. Members can enjoy the confidence that comes with health coverage, but without the higher price tag. The Anthem Enhanced Choice plans offer the coverage you need and deserve. It offers a solution for hardworking Americans who do not qualify for financial assistance created by the ACA or the ACA subsidies. There are tens of thousands of uninsured individuals in Ohio, and they can afford health coverage designed to offer savings and flexibility to meet their needs through the Anthem Enhanced Choice plans. Some details of the AEC plans I would like to call out. If the application is received between the 1st and the 25th of the month, the effective date will be for the 2nd day of the following month. So please note that the effective date will always be on the 2nd day of the month. This is because the plans legally cannot be longer than 364 days. So we are taking the 1 day off of the 365 at the beginning of the policy. If the application is received between the 26th and the last day of the month, the effective date will be the 2nd day of the 2nd month following. So in other words, we need the application in at least 5 days prior to the effective date. Otherwise, it will become effective on the second day of the second following month. An example here, an application that is received on March 25th and approved would be approved for April 2nd. If it's received on March 26th and approved, the effective date would be May 2nd. Members have the ability to downgrade their plans to a higher deductible if needed. The subscriber is allowed to downgrade one time during the benefit period. It does have to be a written request for that plan change. Eligibility requirements must be met, but the medical underwriting is not required in order to make this downgrade. Members do not have the ability to renew with these plans. They do have to reapply when their 1-year term is up. They will receive a renewal notice. Well, the renewal notice will not be sent, but members are notified regarding how to reapply for another year term. So members do have to go through medical underwriting to enroll for another year term, but there is no limit to the number of times they can apply for a short-term plan. We offer 8 plans. These are all on our full Blue Access network for our Anthem Enhanced Choice plans. The Anthem Enhanced Choice plans also have the RX Choice tiered network, our select formulary, optional home delivery, and individual foundational well-being plans, just like our individual policies do. At a glance, this is an outline of the plan designs, and this is also available on anthembrokerhub.com. We did not make any design changes in the plans for 2023. We just updated the contract codes for the plans. Preventive care is subject to the deductible and co-insurance on the plans listed here. We have 2 different types of platforms. The original platform that we came out with was very comprehensive. It covered everything with co-pays and covered preventive care. But we found that there was also an appetite for plans that with leaner benefits that would offer a lower cost share. So that's the plans that you are viewing on your screen right now. That's what these plans offer. The preventive care is subject to the deductible and co-insurance here. These plans also do not cover the more costly tier 3 and tier 4 drugs, but it does cover tier 1 and 2 medications. Another difference to call out is that the office visits are covered with a copay for the first 2 visits. After that, the office visits would go towards the deductible and co-insurance. These 2 plan designs are the ones that are the more comprehensive in their coverage. So they offer 100% preventive coverage. They have copays continuously for the office visits. There's no limit there. And the copays are also included for all tiers of medication on these 2 plan designs. We also want to make sure you are aware that anyone that you have enrolled on an Anthem Enhanced Choice plan will receive an open enrollment letter. This is just going to remind them of open enrollment dates, because a short-term plan, when a short-term plan ends, that does not constitute a qualifying event to then enroll on an individual ACA plan. So if you have members that need to get onto an ACA plan, maybe they won't be able to qualify for another short-term policy, or they want to get onto a plan that will continue longer than a year without medical underwriting, we're mailing these letters out, but they are going out to everyone that is on an AEC plan just to make sure they are aware of the open enrollment dates for ACA individual. Next, let's talk a little bit about our specialty products that we offer. With our Anthem dental plans, we have a very large network. We have one of the largest national PPOs in the nation. There are 137 unique dental providers at more than 474,000 locations nationwide. We offer enhanced dental care benefits, including additional benefits for members with certain health conditions, 2 routine or 4 periodontal cleanings. Child preventive benefits include fluoride and sealants through the age of 18, brush biopsies that are covered for oral cancer detection, and we waive preventive care from deductibles and annual maximums. We are also leading the benefits and customization and innovative solutions with teledentistry, including at-home clear aligners through Ortho at Home benefits. We have accidental dental injury, unlimited and high dollar amount maximums, and cosmetic benefits, including tooth whitening. In Ohio, you can see that we have 4,123 unique dentists just in our state, with 14,808 different locations. With the Dental Essential Choice PPOs, you get more care, more convenience, and more choices and more savings. 60% of employees reported that these benefits are important to them. In fact, integrating medical and dental benefits increases member engagement, and that results in better overall medical care. Our plans offer enhanced preventive care, including the 2 routine or the 4 periodontal cleanings, the brush biopsies, child preventive care services, and waived preventive care from deductibles and annual maximums. Our benefits on the dental plans don't stop there. A few of the additional benefits that we offer are annual maximum carry in and carry over, flexible spending account, claims crossover benefit, and international emergency dental program. Teledentistry and virtual care is also offered through our dental plans. The teledentist is a participating Anthem dental network provider. They offer virtual consultations with board licensed dentists. You do need a computer, tablet, or smartphone in order to reach them. You do have to have a camera available for that. And then again, our Ortho at Home program provides mild to moderate teeth straightening with clear aligners. And this cost for the Ortho at Home program is up to 60% less than traditional braces. Our virtual engagement tools help members to make confident choices. So there are dental care alerts, online dental health risks assessments. Of course, the dental plans are supported by our Sydney Health app, and we also have a dental care cost estimator tool. With our vision plans, again, this is one of the largest national networks, and it offers a mix of independent vision providers as well as national retailers. We have industry-leading discounts of 40% off of unlimited additional complete pairs of glasses, 20% off of accessories and lens upgrades. Members with the Blue View Vision Network enjoy 75% average in-network savings. And we have a 97% in-network utilization rate for our Anthem Blue View Vision Network. In Ohio, we have 1,700 unique eye doctors in 1,200 different locations. And to wrap up our presentation today, I just want to talk a moment about Medicaid. Medicaid redetermination is something that you've probably heard of in the last couple of months. The dates are yet to be determined, but there is some information that we do have currently. There are millions of Medicaid members that can find themselves disenrolled when the public health emergency has ended. There are approximately 525,000 people in Ohio alone that may be losing coverage. And these people, many of them will be shopping and enrolling in individual and family health coverage. So when the public health emergency redetermination and the disenrollments and redeterminations have been on hold during the public health emergency. So when this ends, this is when many of the members are going to be notified that they will be dropped off of Medicaid. Currently, the pause has been extended through October 15th, but we are continuing to monitor this and we'll be making future announcements as we have more information. The administration has indicated that it will provide a 60-day notice before it ends the PHE. And each state will have up to 14 months to complete their redeterminations. So we expect the member change to begin possibly fourth quarter of 2022, and definitely will extend well into 2023. And each state may be offering different carrier and broker guidance and redetermination timeframes, because that is all up to the states. We do see a unique growth opportunity in order to get the members covered, both during and outside of the open enrollment timeframe. So stay tuned with us on that information. We will be providing more guidance, as I said, as more information becomes available. And that is the end of my presentation. We do have an appendix that will be included with the presentation when you receive it, and it has some of the more detailed information such as what changes are happening for deductibles and out-of-pocket limits, details on how to access virtual care, accessing prescription drug lists and formularies. That will all be included in the appendix at the end of the presentation.
Thank you. Thank you. Kathy?
Yes.
Fantastic.
So sorry.
No, I just cut out for a second. So fantastic. Are you ready for some questions?
I'm ready.
Okay, so I have a question for you. Can you maybe go back to the enrollment instructions again? I want to point out to agents that the enrollment process just changed just a little bit, and this is for the good, but it's going to look a little different. You had an enrollment system in the past that was based off of the toolbox, but now we're going to hand you off to a better tool. Are you able to show that?
I do not. Here,
I think there was a link on that. If not, I can.
Let me see if I can.
It was about the 10th slide into it. You're getting close. Yeah, go back towards maybe like the 10th or 20th slide there. We talked about the enrollment tool. Okay, getting close, getting close.
There
Here,
we go.
okay. See login instructions here. Are you able to click on that? If not, it'll be in the presentation that everybody gets. But I wanted to call this out because this is going to be enhanced direct enrollment, which is a game changer for everybody. And want to point out it's going to involve a password, okay? And if I'm not mistaken, you'll use the same password you use for Toolbox?
Correct.
Okay, perfect.
Geoff, are you able to see the screen?
I am. Everybody's able to see that. So I want to call that out, and everybody will get a copy of this presentation. If there's any issues with you logging in, just give us a call or give them a call at Broker Services. Let's get into some questions, okay? And the first question has to do with the rewards program. And so this was, early on that you mentioned the rewards program. Are these rewards available on the individual ACA plans as well, or is it just group plans?
No, this is for individual ACA. The rewards are different from group. The ones that are on the individual plans are the $25 gift card for doing the wellness exam, but that has to be completed in the first 90 days of either the renewal or new enrollment. And then doing the health assessment would be an additional $20.
Okay, great. Next question. Are all the ACA plans both off and on exchange? Are they commissionable?
They are commissionable. And this is not just during open enrollment, but it will be throughout the year. For sub-agents, it is going up to $18 for 2023. This is per member with a cap of 2 members per policy.
Okay. And looks like this might be the last question. By all means, if you have any more questions, but one last question. Will you be offering a training like this for Kentucky? And I'll reach out to my counterpart in Kentucky. It's Kathy Crossfield, and maybe we can set something up like this for Kentucky. And I've sat in on some stuff with Kentucky, very similar to this. And but maybe I could get something set up with Kathy. She's done some different trainings already, but maybe we can set something up for Cornerstone agents as well. And great. Are you able to back out of that screen?
Oh, yes.
Okay. And maybe show your contact information at the end. Okay, let's see. It looks like the screen locked up. Okay. Okay, that's all right. Okay, so the screen is dismissed, but are you able to provide your phone number?
Yes, and I apologize that we don't have that on a slide today.
Okay.
But if you have questions, you can reach out to me. My email address is kathy.shiplett. It's S-H-I-P as in Paul, L-E-T-T @anthem.com. Or my number, 937-414-3414.
Okay, great. All right. Another question. Did I miss coverage about the Lima? Did I miss coverage around Lima Hospital being in the Pathway Network? So Lima Memorial, I believe is the name of it.
Let me check on that because I know that's not one of the areas that we had called out in the highlights. Let me double check and I will let you know what is available in Lima.
Okay, all right. Yeah, all 88 counties now, so definitely Allen County is included, and we'll find out whether or not Lima Memorial is a part of that. So fantastic, Kathy. Very informative. I'm thrilled you could join us today. We're all delighted to hear you're in all 88 counties, added some new networks, such a broad scope of plans you offer. Everybody, we'll get a copy of this presentation. I think with that, we'll conclude it. And everybody, have a great day.
Thank you, Geoff.